This is a model, of course, of a human rib cage. So we have the neck up here, cervical, and we have the thoracic segments here. And attached to each of the 12 thoracic vertebrae is a rib. And the ribs will have different shapes and they'll attach to different parts in the front. Some capture just a vertebral body, this round part of the vertebrae, and it varies from there. A very challenging part of the body to gain motion is right in here. It's full of dense musculature, dense fascia, and lots of ligaments, and the ribs, the upper three ribs don't have a lot of movement, so they are quite stable structures. The lower ribs, especially in the front, mid to lower, have a lot of cartilage here, and they are designed for respiration. And again, the upper three don't have as much movement. Now, over time, we can lose motion in these upper joints, and that can include the lower neck, such as the 7th vertebrae, 1st thoracic, 2nd and 3rd. And a quick adjustment, where it pops and feels better, is probably not going to last for the majority of people. It is dramatic, it does feel good, but I ask you this, how long does that last? And in treating my own body for my own injuries, and I've had several life-altering injuries, I need a small force so the body is comfortable, but it needs to be sustained on the order of, say, 5 minutes or so. And a client introduced me to this tool that I modified slightly to cover this area. And it's called the DaVinci tool. And you can find it online. Massage Warehouse might have it, OPTP, etc. And this red part is the DaVinci tool. So I can lay on the floor and I can use this. It's actually designed for just below the occiput for the upper cervical spine. But I haven't explored their website. They may, of course, encourage other application along the spine, so I don't want to speak out inappropriately. But what I really like about it is this one is very comfortable. So if I had an elderly client, I would tend to recommend using this, or if they have a very small body type, hypermobility syndrome, etc. etc. Now, you can, of course, turn it, and then you have different coverage here. And they're different enough that I find using each of those is beneficial. And then this one is a little bit different yet, okay? And the cutout might be to put less pressure on the nuchal ligament. I'm not sure. I'll have to write them and ask. What I did to modify this so people can use it against the wall is I bought a 1/8 inch by 36 inch plain steel cold rolled round bar. And so I measured it. So we're about 4 inches on each side. And I did have to drill the DaVinci tool. So in this long elongated slot on this part of it, I drilled a hole on both sides. And then I threaded the 36 inch long 1/8 inch wire. And then with pliers, actually I put it in a vise, but you could use pliers as well. Something to stabilize it, maybe just your hand. I haven't tried it that way. And then I just got the end of it, so I had a lot of leverage, and I created a bend, okay? And if you impart the force fully to the angle that you want and hold it there for a while, that can be more effective in sustaining that bend, okay? Materials, there's a name for that. Viscoelastic creep is one name, and I can't remember the name of the diagram that demonstrates that, so I'm getting off track. So what I recommend people do is they hold the device above their head and set it up like yay, okay? And then don't want to hit my glass. I'm going to squat down. So they place it there against the wall, and then they push into the device, okay? They pull on the wires. And for some people, it's not even necessary, but for some people it is. So I'm gonna move way down here. Let me check the camera angle. And for some people who may have limited reach due to shoulder pathology, for example, then this device can help them position it on the wall. Of course, I don't need these wire handles. I can just place it there, you know, and lean into it. But there's about 3 or 4 locations in that part of the anatomy that can be really helpful. It's also really helpful, as I said, just below the neck. And that is the tool's original purpose. So right now I'm doing it right below my occiput. Okay? And then you can move it up a little bit because of the occipitalis muscle overlying the occiput. You can walk it down the neck. And if it's uncomfortable, do not use it. And do not use it for more than 30 seconds to discern if it's helpful to you. You should be guided by your healthcare practitioner. I can't give advice online if I don't have a clinician-client relationship established. So these are ideas to share with your clinician, or if you're a client of mine, then we have that relationship, and I'm leading you to this video, and I hope it's helpful to you. And then of course you can change it up, right? I'm going to spin it so that now I'm going to lean on that part. So I'll put that against the wall, grab the handles, okay, slide it down, and I'm too high for the area I want to target. That's probably T1 there. And just leaning slightly into it. Less is more. I don't want my nervous system to think that somebody's trying to injure me, and then it'll fight me, and it'll create muscle guarding and so on and so forth. All right, so I just lean into it ever so gently, and that's called viscoelastic creep, deformation over time. And then I move it down. I unweigh it and move it down maybe a ½ inch, and that is definitely a different location. All right, so I know I yammer on, that's my tendency, but I hope I've given adequate detail that you can try this. There are other devices, some of them I don't like, but no name comes to my mind. But I like when you can purchase something, if it doesn't work, you can ship it back. I like that concept, and many retailers do allow that. So I hope this is helpful to you, and I just used it with a client this past week, and I think she's about in her 70s, and she found that to be very helpful. I find it to be very helpful due to the nature of my work, leaning over and using my arms, treating people. You can imagine that with a certain amount of force and a certain amount of repetition, things kind of hollow out. And so this helps restore that opening, and I'm yammering more. That's what I do, Jerry yammers. So we'll stop here. Thank you. I hope that if you use this, I hope it's helpful to you.